Good afternoon, everyone. Let me talk a bit about an acute pancreatitis related topic. So we all know that smoking can cause cancer, and eating sugar can lift our blood glucose levels. But what else can cause acute pancreatitis in people without gallstones or heavy alcohol consumption? Well, we are after that, and that's why our work is called the role of lifestyle factors in acute pancreatitis. So yeah, I'm Benedek Kasza. I'm a biotechnologist from Page in the Institute for Translational Medicine. I have a vision that to have improved outcome in pancreatic diseases by a multifaceted lifestyle approach. And therefore, my mission is to identify the major lifestyle-related risk factors to create preventive recommendations. So we started 2 projects. The first one is to assess how modifiable lifestyle-related risk factors have an effect on the incidence of acute pancreatitis through a meta-analysis, a systematic review. And the second one is to examine the correlation between the incidence of lifestyle-related risk factors and the incidence of acute pancreatitis in European countries. This is through analyzing Eurostat data and registries. So let me start with the first one, which is investigating the effects of modifiable lifestyle-related risk factors on the incidence of acute pancreatitis. We all know that acute pancreatitis is the sudden inflammation of the pancreas. 8% of the cases develops to a chronic condition, and globally its incidence is high, and unfortunately this number is rising. We know that modifiable lifestyle-related risk factors plays a major role in development of this disease. However, yet currently we doesn't have any evidence-based recommendations for the people. So this highlights the urgent need for targeted guidance. Therefore, our aim is to investigate how lifestyle-related risk factors like toxic agents, diet, physical activity, mental status, socioeconomic status influence the AP incidence. So our research seeks to answer this question, do lifestyle-related risk factors influence the incidence of acute pancreatitis? We use the PO framework, where the population are human adults. We have 6 exposures as toxic agents, physical activity, body mass index, nutrition, mental status, and socioeconomic status. And our outcome is the incidence of acute pancreatitis. We hypothesized that modifiable lifestyle-related risk factors increase the incidence of acute pancreatitis. And if this is true, then we can eliminate those risk factors, and that's how to decrease the AP incidence. For the systematic search, we built a search key that has 3 domains. The first one is about the characteristics and the forms of pancreatitis. The second one is the pancreatitis itself. And the third one is for understanding how common pancreatitis is, and to find factors that can influence the occurrence of this disease. And by combining these 3 with the search key, we ensure the comprehensive search strategy to catch all the articles that are relevant to our research question. We used it in 3 databases, and after the duplicate removal, we had more than 27,000 articles. So we assembled a team, and after the selection, we had 120 articles. And recently, we started a citation chasing because, let me show you this chart. This bar chart is showing the frequency of these lifestyle-related risk factors that we found in the articles that were selected after included after the full text selection. As you can see, hypertriglyceridemia, alcohol consumption, and smoking are frequently reported, but like mental health or physical activities, not so frequently. And therefore, we hope that with the citation chasing, we can find more articles to find more articles about these factors too. And at this point, I would love to show you beautiful symmetrical forest plots, but unfortunately, they are still in the forest, so we have to work hard for them, and next time I'm sure we can present some results. So the project is at data extraction part with some citation chasing. And yeah, next steps will be statistical analysis and quality assessment. So let me go forward with the second one, which is investigating the correlation between the incidence of lifestyle-related risk factors and the incidence of acute pancreatitis in European countries. For this, we have to examine the prevalence of smoking, alcohol consumption, obesity, physical activity, socioeconomic, and mental health disparities in the European countries, and also get the information about the incidence of acute pancreatitis in the countries. So therefore, we came up with the clinical question: how do specific lifestyle-related risk factors correlate with the incidence of acute pancreatitis in European countries? We use the same PO framework, where the population and the exposures are the same, and also the outcome is the incidence of acute pancreatitis. We hypothesized that the incidence of lifestyle-related risk factors correlate with the incidence of acute pancreatitis. And again, if we can find the most important modifiable lifestyle-related risk factors and eliminate them, we can therefore decrease the EP incidence. So all in all, we are finalizing the data extraction and the statistical analysis for the first part, and continue refining the second one. Our goal is to have actionable recommendations to decrease the impact of acute pancreatitis. And in conclusion, we would like to bridge the gap between the modifiable lifestyle-related risk factors and the incidence of acute pancreatitis. And by finding the most important risk factors, we can start work and go forward with guidance strategies. And as Hippocrates said, the greatest medicine of all is to teach people how not to need it. Thank you for your attention.
Thank you very much. A nice topic and lecture. Who's ask questions from the audience?
Thank you for your presentation. It was really nice. I was wondering about, did you collect also country data, population number? And regarding to that, can you make, do you think is it possible to make related to every country or region to guidelines because of related to the prevalence of the acute pancreatitis, because it differs in the population or in the countries? Yeah. Have you considered it in this way, like the first study, or not yet?
Not the first one, that's the second study. What is about that we want to check the different countries, the prevalence of the risk factors and the incidence of acute pancreatitis, and then we can also do guidelines or create guidelines for it.
Okay, thank you.
Thank you for your question.
More questions? How do you mean that triglyceride is a toxic thing? Okay, we know that hypertriglyceridemia might cause acute pancreatitis, but how do you define that? What is the cutoff value that is interesting and important?
It's really varies among the articles that from which level they are checking it. That's what I'm waiting for, the data extraction, and with the biostatistician, what we can measure, how can we solve this problem. Yes, but yes, we can say it's really a toxic agent, but it can lead to acute pancreatitis. So
that's true. I agree, but why is it a toxic agent? If you want to compare it to alcohol, or
no, it's more like a bad lifestyle choice than having a high triglyceride level, I guess.
Do you think that? It's, you know, why is it elevated at a certain point? Can you tell me why in a certain person triglyceride just goes up and causes hypertriglyceridemia or pancreatitis?
So, okay, what?
That, you know, there are many patients with elevated triglyceride, and there are also many with very high values, let's say 15 and over 15, and still they don't have pancreatitis.
Yes. Unfortunately, I can answer this question then. I have to look after it to give you a proper answer for this.
And what method do you wish to decrease the triglyceride level? To decrease, to treat, to you know, you said that you are you're going to search the methods to prevent.
Yeah, but creating the method or guidance is still not in progress. So when we have the results or the data, then we can create some guidance.
Oh, I see. Okay.
I have one more question.
Yeah.
From which countries? What are the top 3 countries where did you get the data regarding acute pancreatitis? So
It's mostly the USA.
From USA.
China. And maybe UK. Yeah, I think UK was the 3rd. So it's the top 3, I would say.
Thank you.